All right, hello everyone. So I'm Dr. Tushar Mehta, and I suppose that it's already 7:02. We have more than 250 people who have already joined in right now, and the numbers are shooting up. Well, I think it was expected, and I knew that this is going to happen. Today is a very important day for all you viewers, all you listeners here, because we have a legend, we have the maestro of a subject called pathology, the person who has been a pioneer and a trendsetter in the field of pathology, not for some years, not for some duration, but it is more than probably the age of many of the people who are watching and listening to us right now. So he has been a person who has written a book, who has changed the dimensions of the subject pathology. He has, I would say, widened the horizons of thinking of undergraduates as far as pathology subject is concerned. All medical undergraduates have read his book, and even postgraduates also go through the book. Without taking any further time, I would like to bring in front of you not only our guru, but the pan-India guru of pathology, Dr. Harsh Mohan himself. He is a noted speaker, author, leading pathologist, who has been holding the baton of pathology for all of us for such a long time. And it is more than a pleasure for me to have him here on this platform. So first of all, I would like to welcome Dr. Harsh Mohan on this platform, sir. Sir, a very, very warm welcome, sir. A very, very warm welcome to you, sir. Sir, thank you so much for coming out of this platform. I'm really honored and humbled by your presence here. There are a couple of questions that I've already gathered from different people. In fact, the questions have already started flowing in. Okay, so I have already compiled a couple of questions which I'm asking you on the behalf of entire country, the entire medical fraternity, to be very honest, and this is a pleasure for me as well. Sir, there are a couple of questions that we will be starting with. So first question by Dr. Shagun.
Good evening everyone, good evening sir, and thank you so much sir for coming onto this platform, Pathology Bytes. We all feel so humbled by your presence here. So sir, today I'll be asking you certain questions not only on the behalf of Pathology Bytes, but also on the behalf of the entire medical fraternity which I am representing right now, taking this interview. So this is my utmost pleasure, and yes, it was probably one of the things that was always in my bucket list when I took pathology on the first day. So sir, coming back to the questions, my first question is that why pathology? What prompted you to take pathology post-graduation back in 70s or 80s?
Hi everybody, good evening Tushar and Shagun. Before I answer that, it's an honor and a privilege to be coming on this platform, which our young friends are running for quite some time with a very strong passion and motivation. I must congratulate both of them. They have been they are very actively involved in academics, although they have been in private sector. Who says it's only the institutions which are running academics? Both of them have been running it for quite some time. And one thing which I may say before I start answering your question, I was trying to think about it. What are those rare examples where brother and sister are running this kind of thing, or they have been depicted in this way ever in our mythology? And I could only think of the temple at Puri, the Jagannath temple at Puri, which is famous in the country and all over the world for being a temple where Krishna, Balaram and Subhadra, the two brothers and a sister, are depicted together. I happened to attend, I was invited for a oration there way back in 2008. And the people there gave me this as a memento in 2008, if you can see that. Yes. Balaram, Krishna and Subhadra, which are depicted here in this silver plate which they had given. So I could think of that in a mythology where brother and sister are so much attached to follow a passion which they are pursuing. And I must compliment both of you before I start answering on that. Let me get back to the question. You said, why did I pick up pathology? Well, I want to say right in the beginning that I want to be very honest and candid when I'm answering your questions. And the first question is somewhat complex in the sense, and it may surprise many who are listening, that I chose pathology for not love of pathology, but for love of my life.
Oh, wow.
I was,
We want to know
I was in
more.
surgery.
Okay.
I was in surgery way back in 76, 77. And I was working with a famous professor of surgery, Professor S.K.S. Maria.
Yes.
And my senior at that time, immediate senior at that time, was Dr. Sham Singla, who happens to be chancellor there in Gurgaon, where you guys are based.
Yes.
He was 1 year senior to me, and I had joined surgery, was working there. But then I got a job in pathology as a demonstrator and post-station. I was in surgery and moved to pathology because that gave me a job, which was better paying than working as a resident doctor in surgery. So I requested my professor that I want to be relieved and I want to move to pathology. He motivated me quite a lot. Why don't you continue in surgery? Surgery is so very exciting and glamorous. Harsh, you will make a good surgeon. You've been doing well. What do you want to do? I said, I want to marry my girlfriend and her parents will marry her somewhere else. If I don't have a job, I'm not having a job. I was paid 350 rupees as a resident doctor in surgery. The job in pathology as a demonstrator was getting me much more, about 4 times. So it was with a lot of persuasion and haggling with my chief in surgery that I was relieved and I moved to surgery. So it was a passion at that time of a different type. But I pursued my passion in the profession subsequent to that. Once I joined pathology, I developed passion for that profession. And I would say, if your passion and profession become the same, there's no looking back. You're always looking forward. So I followed pathology as my passion in my profession, and I didn't look back. So that's how the story of joining pathology way back in 77 when I joined pathology as a demonstrator and a postgraduate. Yeah.
Wonderful, sir. Wonderful. That's really an insight today. And I must say that this ideology of passion and profession will go deep down in our hearts. Well, I have another question. Shagun, please.
Well, during this journey, I was helped quite a lot, I would say, by people who were in pathology at that time. They were people who were role models, and to mention some of them, like Professor Kusum Joshi was a young lecturer at that time, who later became head of pathology in PGI Chandigarh.
Okay.
She was working as a lecturer there when I was a demonstrator there, and likewise there was Dr. Uma Singh, who was a professor in looking after hematology. So she was a role model. And we had Professor T.S. Jaswal, who was in histopathology and was the person with whom I worked in later years also for quite some time. Unfortunately, we lost him early. These were some of the role models with whom I was able to learn pathology when I joined in formative years. When you start pathology after a gap of few years of having learned pathology at undergraduate level, you are at sea when you begin. So it's totally new. In fact, as an undergraduate, you don't know much what pathologists do. You only know about your slides and classes which pathology faculty take. It's only after joining pathology you realize that pathologists do much more than taking classes.
Wonderful, sir.
All right, sir. That was quite enlightening. And I'm sure all the listeners and the viewers of Pathology Bytes must be taking down the notes from the legend himself. So, sir, I would like to ask my second question. that as an undergraduate student, like back when you were in your second year MBBS days, how much did you like pathology in your college days? I mean, was it your first choice, or it was a kind of subject that you were obsessed with? I mean, we all read your book, but the bigger question that the country would want to know, that which book you used to read.
Yeah, that's interesting because in 70s when I wish I had taken out that book. It is still with me, which we used to read. Got to do that if I had known about it. We were reading Boyd's pathology way back in 73-4 when I was in second prof of MBBS in PGIMS Rohtak. And that was a master book. A treat reading that book. Learning from that book and the flowery language which William Boyd had used in his textbook was masterpiece, no doubt about it. That was a treat. Everybody during that era used to read Boyd's. I mean, my times, you will know, all of them were reading Boyd's. That was the only book. And we used to love reading it. It was very, very interesting and a treat to read that book. Having said that, we always, as undergraduate students, used to make notes as well, because Boyd's was a beautiful book to learn from, but the system of learning in our country and assessment or examination in our country is such that you have to retain and reproduce. It's not, the way Western countries go, where right from beginning of joining their, MBBS, which they call as MD in America, is running by, answering MCQs. So you don't have to write sentences or paras or essays on a topic. That's what I mean. I hope the listeners understand that. System of learning and reproducing, retaining is different in our country. So we used to make notes at that time as well. So that was what all of us were doing. Notes from the book, notes from the class. But we were always following Boyd's textbook of pathology. Boyd's pathology was the master book at that time. But unfortunately, Boyd died in 76, I guess, and the edition could not be revised after that. The last edition is what we read. That's when it ended, and then other books like, Robbins' Pathology Basis and Anderson's Pathology and many others came up at that time. But our time was Boyd's time, which lasted for good 5 decades, I would say. Boyd's time was up to about 50 years when people were reading Boyd's.
Wonderful.
Okay, wonderful, sir. So now that for the first time the country has got to know that Dr. Harsh Mohan, sir, the author of Harsh Mohan's textbook of pathology, used to read Boyd's book of pathology. So sir, I want to ask that how did it come to your mind and you started off thinking of writing a book? I mean, sir, what was the first thought that came to your mind? What was that? How was that? And what you did after the thought?
You see, the authorship in itself started sometime in late 80s when I was a reader in pathology at PGIMS Rohtak. And first edition of the book came in February 92. Precisely on 29th February 1992. That's when the first edition came. I happen to keep this book with me, which I may like to show. This is the first edition. You can see the paperback of that book. And, it was in maroon color, single paperback, and all black and white is what we had at that time. That was the first edition on which I saw the copy on 29th February 1992, which means it's been there for more than 28 years. Now, the thought of writing the book began first by becoming a successful teacher.
Okay.
That was more important before I could think of anything like that. I had been into teaching from 1977 onwards. If I may recall, when I joined pathology, first thing or first class which my professor at that time, Professor G.C. Mehta, gave me was teaching undergraduates urine examination. That's the first class was assigned to me, physical, chemical, microscope examination of urine. And I was given about 2-3 weeks time prior to that. I was conveyed this when I was working, when I just joined as a demonstrator. Now, at that time, this is one class which is very descriptive in demonstration. Although it's a practical class, when you teach the students, it's very detailed and very long the way we teach students. I started preparing that class in all earnest, made notes from variety of sources, and compiled very good notes for urine examination, and then learned more of it, because I decided in my own mind that a teacher who takes notes to the class for teaching is not going to get as much respect. If I recall, when I was a student, I would also not probably give as much respect to a teacher who is carrying notes in the class for teaching. That you don't develop that kind of confidence. So therefore, that's the first promise I made to myself in the first class itself, that I should prepare the best possible notes and learn it. And that's what I did. Learned it well, and then taught the students extempore, without any help. There were no PowerPoints, there were no overhead projector also at that time. We used to have blackboard and chalk for teaching the students. We would write difficult words on the board, and students are taking down notes as you are teaching during those era.
Okay.
Now, that is how my teaching started, because I felt that teaching is a serious business. It's not something which can be taken casually, and therefore it's important to do it well. Once you're doing it, do it well, is what I learned during that time. So between 77 and before, I started writing the book in late, maybe about 88 or so, when I started doing it. I had been teaching for about 12 years in Medical College Rohtak during those times. I had risen to the rank of reader at that time when I started authorship. But I found during those years when I was teaching as a faculty, after demonstrator and I became a faculty, that students were liking the way I was teaching. And they used to take down notes. If I was teaching them GI system, and next year I was teaching them cardiovascular system, these students would photocopy, but we used to call them Xerox at that time. They would Xerox the notes of GI pathology of previous year, which I taught. And Jan Book Depot in Medical More would make photocopies and will sell the notes to students. This is Harsh Mohan's notes of GI pathology, which he taught last year, and now he's teaching cardiovascular. And next year, if I am teaching kidney, they will take down notes of cardiovascular system, like that. So I got this feedback that these notes are in circulation as this hobby, and I thought to myself, what I was teaching the students, which they take as sacrosanct word of mouth, which students take down as notes. There are a lot of transcriptional errors when you are speaking and what they're writing. There may be, transcriptional error, increase, decrease, and decrease, increase can happen when they're writing down notes. I felt, and secondly, I also felt that when I was preparing for a class for teaching, probably I didn't do the best. I did well, all right, but I can do better. I thought about it. Why not give them the best? And that's what I initiated me into writing. Why not do the best by consulting a whole lot of sources and prepare something better than what I was giving them in the classes. So that's how it started. So it started in, about 89 or so. And during this journey, I was helped by some of the former students also. One of them I can relate is Dr. Sanjay Sangwan, who is a senior consultant in Long Island, New York. He was very good in drawing. When the teacher is teaching in the class, he will make a, portrait of the teacher. He was so good. And he was brilliant. He was very hardworking and, sharp. He would spend few hours and learn everything so well. I happened to learn about him, and he started helping me in making some of the drawings for the book. And many of the drawings in the first edition of the book were prepared by him in black and white in pencil and rocker pen, which was used for black and white. And they were colored later and then transformed and everything. So, and another friend whom I recall is Dr. R.L. Ishpujani, who later became director of National Institute of Communicable Diseases, who was a big help to me for initiating me into writing and persist with it, that we should complete it. So that's how it started. The authorship started, and it's easy to start, but it's a big job to finish it because it's a big project, and the book is incomplete till you've written the last word, including the matter on the outer back. So it requires a sustained effort and hard work. The rest is history. So that's how it started. But I must say that this book, which I have shown you just now, the first edition of, I knew it is going to come up in your discussion about how it started. And this book in paperback probably had good content, but was not produced from a top level publisher. It was published from a small-time publisher, Forward publisher, was a small-time publisher on main side of Cali. And second edition onwards was picked up by JP Brothers Medical Publishers, who have done an excellent job in the last about 26, 27 years, ever since I've been associated with them with not only this book, but other offshoots of this textbook, also for dental students, for paramedical students and practical or atlas, so on. So it keeps me busy with all those. So that's how the journey started. I'm sorry the answer has gone too long.
No. This is so intriguing, and I'm just enjoying the journey of how you mentioned all these people who have been a pioneer, who have been instrumental in making this pioneer version. And I will always remember that, the way you said that a good level of teaching is something that is very much required to start authorship. You should be able to know what to convey before you just, go on to write a book. Well, that lesson is, I think, for me, and I will try to invest that before I start writing anything. Thank you so much, sir. Yes, Shagun, next question.
Yes, I just want to thank the stars, the Almighty and the destiny that, sir, you had that thought, and probably that thought turned into a revolution today.
Yes.
That we are blessed with you and the book you have written. And so just you mentioned, even if I remember, my first topic and my first postgraduate seminar was on physical and chemical examination of urine.
That's so interesting. What a strange coincidence.
Yeah, and I remember, and I referred to your practical pathology book, and honestly, sir, that was a savior for me at that point of time. And I could prepare my seminar and the class as well from that very beautiful book. So I really want to thank you for giving this gem to us. Thank you so much.
Thank you. But let me interject here with one more line. That what I learned as a demonstrator for urine examination, I remember that for all these more than 40 years now. I learned the most difficult of the tests also, including for porphyrins or Watson-Schwartz test and all other ingredients which are involved or chemicals which are involved in different kind of tests or bile derivatives. I remembered them off and also. That was the outcome of a conscientious teaching, and I'm sure you must have also, once you learn it to teach, you remember it for a long, long time. Teaching is very good learning.
Yes, sir, very good. So, thank you so much, sir. So, sir, another question that, I've started very early in my career with my channel Pathology Bytes. I don't know what is future holding for me right now, but I want to ask you, sir, that when you wrote that book, probably when you were writing the first couple of pages of that book, did you ever think about it that this book will be mentioned in the history as a landmark of pathology, like forever it will be imprinted in the history of the medical science and the medical fraternity?
Not at all, sorry. It was not at all like that. It was on the contrary, I was quite unsure that, this venture be successful, and there was apprehension that it may bring embarrassment to me, that what does he think of himself? He thinks that he can be an author. Now of course we have many young authors, even postgraduates are giving out their experience in the form of producing books for MLE or PG entrance, and I'm very happy that you're running a very good forum for teaching undergraduates as well as interacting with residents, which is very, very exciting. But our time, to put it bluntly, I was on the contrary quite unsure, and in my heart I was afraid. At one point of time, I had thought of dropping it midway, and that was because one of the pioneer teachers in pathology was also coming up with a textbook of pathology during that time only, from the leading publisher in the country. Once I came to know about it, and that teacher happened to be my examiner during my EMD exam. When I was writing, that was late 80s, and I appeared finally in 1980. So 92 is the time when the book was produced, which means many years prior to that, he was my examiner in MD. So he was that kind of towering figure, and I felt that this book is going to come from such a towering person. And I was encouraged by my friend again, Dr. Ratanlal Ishkujani, who was later director of National Institute of Communicable Diseases. He told me, Harsh, you do your job, others are doing their job.
Yes.
There are chemist shops in a row in a market, or ladies tailor in a row in a market. Everybody does his work. It doesn't mean there is one ladies tailor, the other one doesn't get the work. Or if there's one chemist shop, the neighbor doesn't get it. You do your job, they are doing their job. And rest is for, readers to decide which one does well. And this is what happened, actually. I was a reader in pathology in a relatively, I was not in the central institute. I mean, Rohtak was the place where I was working at that time in the middle level. And, Rohtak has produced some of the best people in the country, no doubt. But still, it was not a central institute like, in Chandigarh or Delhi or Mumbai and things like that. And I was not at the top level or at the institute itself or at the national level. But I think the first edition, although it was not produced well, but probably had good content. That's the feedback which I started getting within a few weeks or months of the first edition. And then it was taken over by JP Brothers, who did not spare any effort in producing the best of the production. They have done remarkable job in what they have done in several editions so far. That's the latest one, the 8th edition.
Yes.
And their production house has been remarkable. And they've also come up with foreign language edition. For example, Spanish language edition, Pathology by same author, and I can't know anything, but as you can see, everything is in Spanish. But the book is translated from English language to Spanish by Harsh Mohan only. I mean, that's very, very fulfilling. When I look back, the JPs have done a remarkable work. We've, traveled together and grown together, I would say. Mr. Vidj and me have traveled together all these about 3 decades since we started our journey in this book. And we've grown up together. We are almost same age, actually.
Okay.
Good friends.
Great.
Okay, that was quite informative, sir. I'm sure the viewers and listeners of Pathology Bytes are getting the true insight about how the legend started his struggle into writing this book, how the feelings have gone into this book. Sir, my next question is, You have mentored hundreds and probably like thousands of students as pathologists, and lakhs of them have read your textbook and have been taught by you. So, what do you think? What is the first quality required for being a clinical pathologist or being a pathology resident?
Yeah, it's very satisfying when I look back all these 3 decades since the first edition came, and since then, if I may roughly estimate, over 1 million copies of the textbook may have been sold, leave aside the book for dentistry or other paramedical. That's been very satisfying when I look back. And the other thing which I have seen in recent time, in the last about 5 to 7 years, is that many people will, as parents, will come forward and say that, I had read your book and now my son or daughter is reading your book. So 2 generations, it's gone through 2 generations. So it's very, very satisfying. And it gives you great amount of, feeling blessed, I would say. That I feel quite blessed with this kind of love and affection from people. The main quality I would say is that, for a pathologist, as you know, there are roles as a teacher, as a diagnostician, as guiding for the research to postgraduates, and when you grow up in position, you also have administrative role of variety of types. Now you have to divide your time accordingly, and on the side you are also doing authorship of the type which I was doing at that time, and not only stopping at one, because you can't just harp on the glory of what you have done one time. So then it becomes a one-time show only. You have to maintain that and pursue it and take it further. So that's very important. And for that, I think the guiding principle, I would say, is hard work combined with attempt to perfection.
Okay.
There's no shortcut to hard work. You may do hard work, you are likely to succeed, or you may not succeed. But if you don't do hard work, you are not likely to succeed at all. It's a fluke if somebody succeeds without hard work. That's rare. And you can't do that fluke again and again. And the other thing which I learned, and I have followed, I'm not preaching. I'm not a motivational speaker or anything like that. And I've told you my weakness and my strength and how I started as a passion for something else than pathology at that time. Incidentally, that girlfriend is my wife for 41 years now. The girlfriend for 46 years. And I learned it early on. Trying to do it well is a bottom line. Hard work combined with attempt at perfection. Whatever you do it well. It's better to say no than to do it badly. So I think that's very, very important. When you do anything casually, you are not likely to succeed. You follow a shortcut, you are not going to succeed. So hard work combined with an attempt to do it well or attempt to do it with perfection. I always draw a lot of happiness when I complete one edition of my book or a new book. I feel I have done the best because I try to do it well during that time. But then when that edition starts going to market and one first copy which I see, always I keep it with me as my copy for markings. I start marking it from the day I see the book. And I find mistakes in it, and I find new insertions to be put into it. So I try to do it well in that time and space of that edition. But there was scope of doing better, and that's what I try to do with every successive edition. So you try to do well or try to do perfect, but there's no end to it. This in Mr. Bid's language is like this. Every time you sweep the floor of a room, you will find some dirt coming out of it.
For sure.
You've done sweeping of the floor in a room, and you do it again, you'll find some dirt coming out of it. It's like that. You go through the book again, you find something which you feel you can do better than that. So you can't harp on the glory of one time. You continue to do well and as perfect as possible, and that requires a lot of hard work. I have repeated these two things, most important ingredients which are required for being successful in any venture, and I can say from my experience that is important.
Wonderful. Quite, enriching in knowledge also, sir. I have a couple of questions from the live audience also, but I think we will cover those questions. Like there is somebody who's asking about prospects of cytogenetics in future. Dr. K. Goyal has asked, particularly doing data, so we'll cover into that. Okay, Shagun, next question.
So thank you so much, sir, for such a valuable advice for all the pathology residents. So my next question, actually this question is from a third year resident of pathology from Maulana Azad Medical College. So the question is, how do you think that some students who want to take up pathology because of their unconditional love and interest for this branch, but they end up taking some a clinical branch because of peer pressure? So do you think that this branch has lost its charm, or it's just that the motivational level is not enough? And I am asking this question on the behalf of a third year resident who didn't comply with the family or the society and always wanted to take up pathology and took it. But still there are many people who do not take up pathology and they instead take up a clinical branch, thinking that pathology is more of a paraclinical thing. So sir, I want to ask you, because personally I'm like being very junior to you, but still I feel that it is the basic pillar. Pathology is the basic essence of medicine and surgery, because this is something through which we can do a horizontal and vertical integration. What is your take on that, sir?
Yeah, I think this is a very important and interesting question. Of late there have been, the merit for pathology during the PG counseling has been going down for the last few years, ever since PG seats have increased. And that is combined with the relative paucity of jobs, although this is a very competitive world, and the best ones survive. That's how it is. The survival of fittest and survival of the best is the bottom line. There's competition in every field now, every specialty as well. And you can make a success of yourself in any field. There's no doubt. Pathology, I've been blessed, but I have never regretted joining pathology ever. I moved from surgery to pathology. I've never regretted. I narrated this just because you answered me. You asked me this question, but otherwise I never have ever any regret of coming to pathology. I agree that this has a insight of all specialties, and you're dealing with all aspects. Leave aside the treatment part, but you go from beginning to the end, including complication and everything. But yes, there has been paucity of job, but greater problem has been underemployment because of more number of people becoming available. This has been largely because institutions have been asking for more number of PG seats just to satisfy the requirement of the institution, because the institution says that you have X number of professors, so you have more seats. They are not looking at the demand of a particular specialty and the production according to that. They are not looking at that, with the result that there has been a lot of underemployment, I would say, rather than unemployment. Underemployment means that some of the pathologists are employed on part-time basis, for smaller remuneration, and the young upcoming pathologists feel that this the kind of job I'll be doing. So they are doing different type of work than what they were trained during their post-station. So that's something which is disheartening. But then the positive aspect of this is that there are such large number of newer avenues in pathology as well. If you look at it, when I see young people going into teaching through digital forum or going for reporting through digital forum, and going for super specialization into variety of subspecialties, whether in India or other countries, and then come back with so much of confidence, and they are so productive. So I think it applies to all specialties, not pathology only, but there is scope of doing well. Only thing is you need to persist with what you want to pursue, and you need to do it with hard work and continue. Enjoy doing what you're doing. That's important. If you're doing pathology, you should don't think that I've been forced into pathology. When you're doing residency, you should enjoy doing that work. Is more important. And then at the time when you are in practice of pathology, you try to hone your skills more and more and become unique, different. Somebody becomes a renal pathologist, somebody is known as a neuropathologist, and somebody goes across and start doing transplant pathology and so on and so forth. So variety of stuff, and there's no looking back for cytology. There is so much of work going on in cytology, especially in this country, which is got a unique status all over the world. So much of cytology being done in this country, and also contributing to scientific literature from this country on cytology. So there's no looking back if you continue to do better and better and hone your skills and go for variety of. You need to be innovative. You guys are innovative, I would say. Shagun has been innovative in starting a forum at a young age. This is innovation. I see many other people. Somebody who is a gynecologist is started, a forum for teaching on pathology or all other specialties as well. So authorship or digital teaching or super specialty practice or improving your skills and all those things you have to think out of the box for doing well. Yeah.
Thank you so much, sir. Sir, there's something that I have always believed. Like coming from a family of doctors, my dad is an ENT surgeon, so I have realized, I would say it in Hindi, that scope branch में नहीं इंसान में होता है जो उस branch को करता है.
So look at Dr. Indrabir Singh's book on anatomy.
Yes.
Professor Indrabir Singh, yes, the pioneer teacher in anatomy.
Yes.
He was our teacher, and his books were masterpieces, and they're still doing well.
Yes.
Sir is no more, but his books are doing so well. And he was a great teacher. The kind of teaching he used to do, he was only into teaching. We are teachers as well as diagnosticians.
Yes.
I'm attached after my retirement to a corporate hospital as a diagnostician to do diagnostic pathology as well, besides authorship or teaching and all that. But, specialty like anatomy doesn't have those kind of add-on things. But you can make a success of yourself, like you said, in ENT. Look at the master teacher in anatomy. We learned so much things. He helped me quite a lot in authorship also, by the way. Thank you.
So there is one question that I would want to take live. This is a question from Dr. Datta. The question is scope of research in pathology in India.
Yeah. There are limitations for high-end research in our country because of infrastructural constraints. Although some of the top institutions in the country are doing pioneering research. If you look at places like Indian Institute of Medical Sciences, New Delhi, or PGI Chandigarh, or Sanjay Gandhi Postgraduate Institute, or some of the top places in Mumbai like Tata Cancer Hospital, they are doing pioneering work in research as well. But we know that we have infrastructural constraints in our country. This is in general. But within pathology, there are so many subspecialties. So there is a lot of activity on research going on in subspecialties. Some of the things which are done from India only, like as I said, cytology is one, which has uh, come to the world forum from this country. But cytology is more often morphology.
Okay.
Histopathology is morphology coupled with a large panel of immunohistochemistry. We have limited panel. Some of the institutions have more panel, but not only that, there is so much of molecular biology and cytogenetic integrated into classification or prognostication of many tumors in histopathology. So there may be some constraints on that. Cytopathology certainly has done wonders. We have a very large panel of immunohistochemistry and for molecular biology and cytogenetic in the lab with which I'm attached. That's the Onquest laboratory. They have a very large panel. So of late, they have been trying to compile the data which they have accumulated, huge data. So there is scope of doing research in some of the top level institutions where there is good infrastructure. That's what I can tell you. The kind of autopsy work which is going on PGI is unique in the world. Nowhere else it's being done. And that's the kind of pioneering work which they have been producing and publishing at World Forum. So they are leaders in autopsy all over the world, not only in India. So there is so much of scope of doing work from this country in pathology as well.
Okay, well, that was an insight. Even I was not aware of it. Yeah, Shagun, next question.
Yeah. Honestly, before asking my next question, I want to tell you, sir, I'm still in that awe that I'm talking to you live.
Thank you.
Because my love for pathology, the way you said, I never regret that I took pathology, because my love for pathology is because of you and your book. Back from my second year days until my post graduation, and now also, I just love that book, and I'm really thankful to you that you gave that gem to us. Again, I want to say that, and I really love this field, and that love that cropped in me back in my second year days was just because of this beautiful book that you have given to us. Thank you so much, sir.
Thank you so much. I feel blessed by love and affection of people. And that motivates and persuades me to do more and more and better, I would say. More and more means more books and better by successive edition. Thank you so much for all this. That's very, very satisfying. Thank you.
Thank you, sir. So my next question is, how do you see the scope of pathology in clinical career? Why I'm saying this, because I'm assuming that many budding as well as studying pathologists must be listening and watching this interview, and they wish to see 5 years ahead how they will be having their professional, educational and financial satisfaction. So I'm asking this question because I want to brief everyone here that you have not only started the Department of Pathology in GMC Chandigarh, but also at present the clinical head of pathology in Paras Hospitals, Panchkula, that is a corporate hospital. So, sir, you are a perfect example of academic as well as entrepreneurial skills. So, nobody will be better than you to guide all of us. So, that is why I want to ask this question.
There is one live question also from Dr. Gur Arpan Bedi. I think Dr. Saab is a pathologist himself or herself. Entrepreneurial opportunities in the field of pathology along with academic excellence.
Yeah, let me answer the question from Dr. Bedi first. Entrepreneurship in pathology. I think there's more and more scope for entrepreneurship in pathology, in clinical and cytopathology. Histopathology has a lot of constraints in diagnostic pathology by an individual. You require more experience. Maybe at times you need to go across for another opinion as well. So histopathology in the beginning of your career after your MD is not, unless you have support base in the city from somebody where you can go across, discuss the case, which is what you should do. One should be very honest about it. But entrepreneurship in applied pathology, that's clinical pathology, and that includes hematology and cytopathology, has great scope. They are doing well. And for that, you need to, have kind of image-guided psychology as well. That's also important because otherwise you're doing only slides prepared by others. There is a big advantage in cytology in the sense that the procedures, especially the FNA procedures, are done by the pathologist himself and gains a first-hand knowledge about the patient and his symptomatology or clinical examination and doing FNA yourself. So therefore, rather than getting slides from somewhere and then reporting is not as good idea as doing it yourself and also collaborating for image guidance. And coupled with that is hematology and clinical pathology. And for histopathology, I think it's important that you have support base also in the city, whether from institution or from some more experienced person that way. That's the answer to Dr. Bedi's question. Now coming back to question which Dr. Shagun has raised. That was about, you said students, right? At different level, undergraduates, postgraduates, and practicing pathologists. Is that right? That's the question.
Yes, sir.
Right. My message would be that for undergraduates who are pursuing, learning in pathology, my message would be that whether you attend a class or not, because I have been teacher for between 77 to 2015. That's close to 40 years, 38 odd years, between 77 and 2015. I always felt, and some of my former students may remember it also, when I'll ask a question at the beginning of the class to reconnect to previous day's class, the student will get up and say, "Sir, I was not present in the class yesterday." And my spontaneous counter question would be, but it doesn't go out of your syllabus if you were not present in the class.
Yes.
So my first message to undergraduates would be, whether you attend a class or not, because there have been a tendency for students not to attend all the classes. They attend classes of their interest, depending on the subject interests them or not, or teacher interests them or not. And they try to comply with the regulations of medical council, and therefore they try to attend as many classes as are required. Some of them start preparing for MLE or PG entrance, and they think we can spend our time better in library than to listening to this kind of teacher. Some teachers, not all. I never had this problem.
Yes.
But I would say to undergraduates of all types, toppers, average, to which all of us belong, mediocre students, all of us belong to that, toppers, and below average, that regardless of you attended a class or not, please read that topic or lecture which has been taught in the class. It's very important to have continuity. If the continuity is broken, you lose a connect to what is going on in the class. If you miss a class and go after a gap of 2 classes, there was a wedding in the family or somebody was sick or whatever reason, and then you go back, you're totally disconnected. It's very important to stay connected, and for that, you should read whatever has been covered in the class. There will never be ever looking back for such a student who goes back and reads whether he attends a class or not. Because nowadays the times are different. Our time was reading from books or preparing notes. Now they have learning material from variety of sources. Right. There are so many books, there's internet, there are forums, there are digital apps available. There's so many ways of learning for students. They are enriched and they are much smarter. But it's important to stay connected with the classes, is my message to the undergraduates. To postgraduates who are pursuing pathology, I can say it for postgraduates in pathology, and also it's applicable to other resident doctors. In pathology, most important thing is to make your observations independently. When you are seeing slides, it's important to make your independent observations, and subsequent to that, go through from the book about the difficult case and discuss with your friends. But don't get biased with what other person is showing you. Eyes don't see, which mind doesn't know. You need to read also. The mind will know if you have knowledge. So you need to read, but you trust your eyes first and be independent in making your observations. Microscopy is all, image-based study. An image-based study is interpretation based on your knowledge combined with your observation. So this is very important to make independent observation. I've been going as an examiner to all the institutions, including the best of them. This is the message based on my experience of dealing with pathology residents all over, either as their students or as their examiner. To make your independent observations and then go back, discuss or read from those to add to your knowledge, and then go back to slides is the other thing. Then our practicing pathologists there, and as I said, I think that's an answer in my answer to question to Dr. Baby for practicing pathologists. I think that's what I need to convey to practicing pathologists, that they can be enterprising in a variety of subspecialties as well.
All right, sir. So we have one more question. Yeah, please.
Yes, sir. So now, sir, you have mentioned about the corporates. So, how do you see the role of corporates in pathology or in the entire hospitality sector?
Having worked in government institutions for good about 38 years and now been in corporates for about a few years, I would compare quality and quantity.
Quantity.
Yeah. So in government institutions, we have huge volume of work. There is big quantity of work, although we have teams of people in the departments. But then there is huge volume. So you get tremendous exposure to your skill during working in good institutions where there is more material, and those places where the material is not adequate, I think the students are quite enterprising. I mean, I'm talking postgraduate students. They are enterprising and go across to other institutions to learn, or they go to forums or apps to learn more and more. But nothing to beat seeing the slides, glass slides. I'm an old timer, I would say seeing the glass slides yourself in the microscope is what is important. Now, corporates have advantage in pay for the services. There is quality, but pay for the services. So those who can pay for the services, they get high quality work. I can say it on the basis of my experience on what we do in corporate is producing, best of the quality output of our report based on, CAP guidelines. That's what we follow. The American Pathologist Guidelines is what we follow for producing the reports. And we go for an entire spectrum of ISC profile of panel, which is required, and sometimes cytogenetic or quantitative phase or whatever is required. We will do that for a case, and or molecular cytogenetics or whatever is required, or immunofluorescence, everything, whatever is required, that is done. But there's a price for it. So you get quality and you pay for it. So corporates have the quality, but there is no complimentary service there. That's how it is. So working in government institutions, we gained huge experience because the volumes are enormous, but there are constraints of variety of types, and therefore, whether there's because of infrastructure or spending, because after all, health spending, of us know it by the government, is limited. So, services are provided combined together by corporates as well as government hospitals. Yeah, that's it.
Well, I must say, sir, you have seen both the worlds and managed them so well. I don't see many people doing that. I mean, both the medical college era and now, working with a.
But I'm working in corporate, not for big money. I'm saying.
I know,
Microscopic work.
honestly, I would like to use this platform to tell many people that people who have worked for more than 2 decades in a government setup, they find it very difficult to adjust even in a corporate setup. I mean, I have seen that with some of the professors previously. So when of course, everyone knows that you have written such a magnificent book and everything. But when I was trying to find out more about you, I got to know that you are working in a corporate setup. So I was astonished because people are not able to, they're not able to gel up in a corporate setup once they've spent maybe 10 years or 15 years or 20 years in a government medical college. So this quantity quality thing that you told is excellent. It's very good.
Yeah, you see, everybody decides for himself what you want to do after first innings. There are my friends who are working in institutions as professors or directors after their first innings is equally good. I'm not belittling anybody, but I chose for myself to be in corporate because I wanted my freedom and limited time for diagnostic, limited time for my academic work of teaching or going across as a faculty, or devoting time for my authorship or pursuing other passions besides all this, whether it's gardening or music or something else, travel. So I wanted time to myself and my family as well. So I decided like that rather than spending time of commuting and spending long hours as I was doing in first inning. So I decided for myself to be in corporate for a few hours where I go for doing reporting. And OnQuest gave me this freedom that you can come and do reporting and not be there from 9 to 5.
9 to 5.
Thank you.
Now this thing that you have said, sir, about you wanted time for your hobbies and passion and gardening. So next question is actually based upon that. So much amount of pressure in the medical community right now, whether preclinical, paraclinical, or even the clinical branches. So a word from you will be very good. Shagun, next question.
Yes, sir. So now that you have illustrated the branch of pathology and unleashed all aspects of it. So, sir, my question before we sign off, although we don't want to, but what advice you want to give today's generation of doctors? Like, how do they balance their personal life and their professional life in the medical career?
Yeah, it's tough balancing in the beginning, actually. In the initial periods, it's been struggling. All of us have struggled quite a lot. I'm not going to narrate all that at this forum, but we've struggled a lot in the initial years, with very little, luxuries with us, or which are not luxuries actually in the current time to have a fridge or a scooter. I would say luxury at that time, but nowadays it's different. It took me time to have that, but then I feel so blessed when I look back all these things which we were able to get by struggle and then continue to work hard. I would give due credit to my, companion, my friend, and my wife for being with me during struggling time and in the best of time. Okay. She has seen everything. We've grown up together. We met when we were in early 20s, maybe 21 or so, and we are, I shouldn't tell my age at this stage, but I mean, we struggled in the initial periods, and that's how it went on. And she was a gynecologist, and her time was very demanding. A lot of times I would spend a lot more time on my daughters than she could spend time. So there was a time like that. And now she's privileged that she's taken a retirement from professional work and doing just a social work or devoted to music. She enjoys. She had a passion for music, and she, pursues that passionately. And she's not attached to an pastor. But the bottom line, I would say, I never let my home come to my work or my work being brought to home. I think that's important. You lose dignity and self-respect if you do that. If you discuss your family affairs or your children and matters pertaining to things about your, extended family and all that in your workplace, and alternatively, if you discuss your departmental or institutional affairs back home, puts off your children, puts off others, and they hate to, be a doctor even. The children will not like to become a doctor.
Agreed.
They will not like to follow that profession. They keep talking about medical profession only at home. So it's best not to bring home to work
And work.
or work to home.
Yes.
That's how you need to do. Yes, it's delicate balancing, and you need to do that. The initial periods are a little struggle, but if you put in hard work during initial years, they are rewarding, and it's important. I would say when you go to work, enjoy doing it. Leave aside all of this. Of course, health issues are important. If somebody is sick at home, then it's a different matter. But enjoy doing your work and give your best. Once you go to the department or an organization, you give your best. Don't be casual. And don't while away your time. Because when you go to work, you go in the best of the presentation form. You shave or you dress well, apply lipstick, or you wear nice iron clothes, and you wearing the best outfit. Try to give best also at that time, because at home you are spending less time during awake hours compared to the number of awake hours you spend at your workplace, and therefore try to give your best, I would say. And when you're home, you try to do well. Again, I'm coming to the same. Try to do well whatever you do. So your home, don't bring your work at home. That's how I think.
Compartmentalization, I think, is the priority right now. Where we need to create compartments, professional and personal.
Right.
Sir, any, of course, we don't want this to end, but we have to. So any last minute tips or guru mantra that you want to give? Now the numbers are shooting up, so we have many people who are joining right now. Even some people are messaging that, we've missed some part. So, and don't worry guys who are listening and watching, we'll be uploading this. You are messaging me again and again. So we will be uploading this interview. Don't worry. Sir, any tips or guru mantra? Many of the budding pathologists and even I could say a couple of clinical pathologists are also there.
Well, I think to sum it up, I think it's important to take out some of the things which I said, like, develop passion for your profession, which means enjoy doing what you are doing in workplace, and you will never look back. You will be successful, and try to put in hard work, and whatever assignment or work you're doing, try to do it well at that particular moment. Some people are good at multitasking, many are not. But whatever you're doing, try to do it well. Some can do multitasking as well. That's all right. But it's important to do it well, whatever task you're doing. It's better to say no than to do a task casually, I think is another important life lesson, I would say.
Indeed.
And, divide your time properly. You spend time for work, spend time for family. Friends are very important. Your social context, your friends and your society is important as well. So you need to interact with them and not be lonely. And do pursue a hobby, whatever. Because medical profession is so very stressful. Some people succumb to the pressure of medical studies, whether undergraduates or postgraduates. So it's important to pursue a hobby as well, rather than just studying or reading or working only. It's important to have a hobby, whatever interests you, whether it's music or dance or gardening or cooking or reading, whatever interests you, it's important to pursue it. Your games, playing something, so many things. But I think these are some of the important things which I would say need to be followed to have a balance of your body, mind, and soul.
Yes.
That's what is important.
At the end of the day, I think keeping all three in sync and sane is the most important part. Absolutely. Absolutely true, sir. And I hope that, the coming generations also, they realize and they don't just fall into the trap and the rat race. So no words are enough to, express our respect for you, the love that we have for you, the appreciation, the affection. Right from the first phone call that I had with you, it was full of affection, and I could really feel that the person who I've been reading for such a long time, and it was kind of overwhelming for me. But the way you took it, in a stride, that you said, okay, fine, we'll do this interview, not a problem, and we'll do that. That is something which shows that at this stature also the humbleness that you have, that the roots that you're attached to. I just feel blessed to be a part of your society probably now. So thank you so much, sir. And with a heavy heart, I think that we have to bring this towards an end. No words are enough to thank you. As I said, just one promise that please do bless us always. And we're looking forwards to have more successful editions of this textbook of pathology, and I just wish all the best to you, and I feel that it will be my destiny that if I get attached to you in any of other things as well. And Shagun would like to sum it up as well.
So thank you so much for enlightening all of us, and as it is said that no words are enough to thank you, sir. Thank you so much. You have always been a guiding light, a mentor, a teacher, a leader for all of us. So please keep blessing us, keep guiding us, because we want to carry forward this beautiful journey of pathology under your supervision. And I don't want this interview to end, but with like he said, with a heavy heart, we have to end this. But sir, I want to request you one thing. Please, like if you get time in future, do visit our channel, Pathology Bytes. Even a word from you will be more than a book for all of us. And if you come up with some clinical case discussion anytime in future on this channel with us, that would mean, sir, the world for me, because you are and you will always be an inspiration to me and to like entire country, all the budding pathologists. So thank you so much for guiding us always. You are my guru, and as we always say, the pan-India guru. Thank you, sir. Thank you so much.
Thank you so much. And you guys have been wonderful, and you have been both very enterprising, and you've been so active in academics, in running the forum, as well as in practice. I think you guys are doing a wonderful job. My best wishes to you. And I repeat what I said at the beginning by showing you this.
And I will always remember this.
This silver plate of 2008, which was presented to me during oration from Odisha, where a picture of Balram, Krishna and Subhadra,
yes,
the two brothers and their sister, is idolized in Jagannath temple at Puri. You, brother and sister, rock.
Thank you so
wish
much.
You all the best. Wish you all the best.
Thank you so much.
Thank you so much. And thanks to all in the audience. I couldn't see any of you. I can see only myself. Probably some image video, whatever. I could see only my picture on the screen. I couldn't see any of you. But obviously, audience, which is most important component, we can't see them here. But thanks to everybody who has joined this interactive session, and they are free to interact with me by any way. I'm available on my email, and I respond to every mail which I get, or every message on Messenger which I get. I respond to that and respect all that, if somebody has taken out time to write to me. Yes. So I always respond to all that. So all the audience are welcome to interact with me on any of my email is given on all my posts, and I'm on Facebook and I'm available on WhatsApp as well. Thank you so much and wish you all the best.
Thank you so much. So, all the listeners and viewers, I will be sharing Dr. Harsh Mohan's email as well, along with the video towards the end, and you can access that email ID from there as well. And thank you so much, sir. Thank you so much. It's a pleasure for us. Thank you.
Thank you
so much.
All the best.
Thank you.
Thank you.
Thank you.
Good night.
Good night.
Good night.
Bye, sir.